Okay, you're attending an 8-year-old male, Ralph, who was playing at home in his lounge. His mum saw him have what she describes as a fit. He fell to the floor and has remained motionless and apparently lifeless since.
So, assessing for dangers for myself and my crewmate.
There are none seen as safe.
So, considering my patient assessment triangle, what colour is Ralph?
So Ralph is very, very pale and blue round the mouth and nose.
Can I see any work of breathing?
None at all.
How's he laying?
As you see him now, and he is motionless.
So no evidence of any trauma,
No.
any
No.
drugs around or anything
No.
like that? Okay, so Ralph!
No response.
Give him a trapezial squeeze.
No response.
Okay, Caroline, we've got an unresponsive child here. You start getting the machines on their feet
Yeah.
out.
Do you want me to put the pads on, Sandy?
Yes, please. Looking in his airway.
There is nothing in his airway.
So put him in the sniffing them all in air position because he's an 8-year-old. Look, listening and feeling for any breath, feeling for a pulse, and also looking for any signs of life.
There are no signs of life.
Okay. So Caroline, I've got confirmed cardiac arrest. Please get everybody here to help against.
So priority call, 361, confirmed paediatric arrest.
Okay, so 5 rescue breaths. 1, 2, 3, 4, 5. So the pads are on. Looking at the rhythm, he's in VF. So Caroline. Caroline, I'm going to go on the chest.
It's confirming we're 100 joules.
Excellent.
Checking, charging to 100 joules. Checking, charging to 100 joules. Okay, ready? Top, middle, bottom clear.
Okay, we can get on the chest, please, Caroline. That's great.
Hello guys.
So good to see you guys. Teresa, could you come and take over the airway for me, please? Just got a bag valve mask attached to the oxygen. If you can upgrade it as soon as you can. Kylie, because we think it could be hypoxic arrest, could you please get out the stuff for Teresa to upgrade the airway for an
Yeah,
ideal
no problem. Okay.
I think the book said it was 2.5. I'll just double check for you. Ideal 2.5. So let's start thinking about our reversal causes. So hypoxia at the top of our list because he had a seizure. We're thinking it could be that, and we're currently correcting it. Teresa, can you let me know when the airway is in, and if it's working and what the capnography is once you get to that point? So next on my list is hypovolemia. So Mum, can you tell me?
He's not on any drugs or anything. He hasn't seen the doctor for years.
So been eating and drinking normally?
Yeah, eat and drink. Yeah.
No evidence of any blood loss at all.
Got about 30 seconds, Sandy.
So hypothermia, does he feel nice and warm, Teresa?
It does.
Okay, so we can check that once we've sorted out what's not on the top of our list. And hypohyperkalemia, very unlikely. He's got no medical history known.
Good air entry.
Thank you.
Start this one.
About 10 seconds.
Lovely. So Kylie, once we've done this next rhythm check,
Yep.
can you get ready to go on the chest, please?
Of course.
2 minutes.
For 2 minutes, let's do that rhythm check. Patient is still in VF, Carly on the chest. Caroline, can you deliver another shot,
Hundreds
please?
or hundreds. Everybody ready to shop?
Yep.
Top, middle, bottom clear.
Thank you, guys. So, Caroline, could you get me some IV access, please? If there's not a vein looking at you, if you can put in an IO, please. We won't fluff around. We'll get straight in with an IO. That's fantastic. Thank you so much. Carly, if you can keep an eye on the time,
No problem.
please, that'd be great. So thinking about my other reversible causes, DNRHs, thinking about LTs, tamponade, any evidence of any trauma, it's not had any accidents?
No, not at all.
Okay. Toxins, see a bit of a scalable, see a bit of
No, I'm really careful. I keep everything locked away. You can't get anything.
Good, so we don't think it's like to get Teresa, could you have a quick look at his pupils while you're up there, though, just to see what they're up to?
Good compression.
Pupils are size 2.
Okay.
Minute to go.
So, thinking about potentially pneumothorax. Teresa, are you getting bilateral good air entry?
I am.
And is it easy to bag?
It is.
Good, so it's unlike mutation, so it's not an asthmatic or anything like that?
No, it's fit to fiddle.
Cool. And our final T is thromboembolic, is unlikely in an 8-year-old.
30 seconds.
How's that IO coming on, Caroline?
Yep, I just need to flush the breathator.
Fantastic job.
20 seconds.
Is everybody doing okay?
Good compression.
Everybody happy with the roles they're doing?
IO connected.
Thank you.
10 seconds.
So we could do another rhythm check. Caroline, if you can then get ready to take on if after the shot we have to deliver one.
That's 2 minutes, Sandy.
Okay, so looking at the rhythm, we're still in VF. Carly back on the chest. Caroline, please deliver that third shot.
Charging to 100. Is everybody ready?
Yes.
Top, middle, bottom clear.
You can get on the chest, that'd be great. So Carly, if you can sort out some drugs for me now,
No
please,
problem.
because we've given 3 shots. We're looking jail health. I'll just confirm with you. Adrenaline, we need 2.6 mils.
Yep.
And amiodarone,
4.3.
4.3.
Yep.
Cross check, confirmed.
Lovely, thank you. Teresa, do you mind marking amiodarone 4.3 mils, please, now?
Right.
Thank you. Drugs are complete.
Good compression.
About 10 seconds.
You're right, Caroline.
Okay, so we're going to get ready to do another rhythm check. Carly, if you could go back on the chest
No
if
problem.
required.
Okay.
Okay, so doing that rhythm
2
check.
minutes.
It does look like they could have a pulse. That can we have some pulse checks, please?
You have 3 pulses.
Fantastic, Teresa. If you can flag the ROSC for me, please. Okay, so in an 8-year-old, we should have a respiratory rate of at least 20. So Teresa, if you can support his breathing and bring that rate up to sort of 1 every 3 seconds, please. That'd be great. So now let's take a breath and do our post-ROSC assessment. Starting with airway. So over to you again, Teresa, if you can assess that airway.
So looking in the airway, is it clear and patent?
It is clear and patent.
Does it require any suction?
There's no suction required.
Airway is clear.
Thank you. Carly, if you could do a breathing for me, just do a flaps
Yes,
assessment.
no problem. Teresa, can you pass me those stethoscope, please? I'll make you know, right. Okay, so I'm going to perform a flaps assessment. I'm going to initially feel the chest. I'm feeling for equal rise and fall in any abnormalities. Have I got any of those?
Equal rise and fall, no abnormalities.
Lovely, thank you. So I'm going to sit back and I'm going to look as well as Teresa ventilates. Are there any abnormalities, any problems I can see?
No problems you can see.
And equal rise and fall again.
Yes.
Lovely, I'm going to auscultate 4 quadrants. Teresa, if you can ventilate for me.
Yeah.
Thank you. Any problems?
No problem, he's got equal air entry.
Thank you, and now I'm going to the plus. Any
Cushion
problems?
is normal.
I'm going to search. I'm feeling for any abnormalities, flower segment, any crepitus.
It's all normal.
And are my hands clean?
They are.
Thank you. Caroline, do you mind attaching an SPO2 lead, please? What's the SATs?
Sets are 95.
And what is end tidal, please?
End tidal is now 4.8.
Brilliant. And Teresa, when you ventilate, can you feel any resistance?
No.
Respiratory assessment's complete.
Excellent, excellent. So we're doing a good job so far. Caroline, could you do a circulatory assessment for me, please?
Yep, certainly can. So we'll start with a 3-point pulse check. So Teresa, you've got the carotid there, so I'll check regularly.
You have 3 good pulses.
Lovely. Teresa, if you can stay on that carotid and obviously let us know if it changes.
Yes.
I'm going to do a central cap refill.
2 seconds.
Excellent. Carly, if I give you the 12 lead, can you pop that on for me?
Yes, certainly.
And I will get the blood pressure up on. Thank you. Got to finish that in a second. Thank you.
Just going to remove the cup.
Blood pressure's going.
Blood pressure is 102 over 60.
Okay, so referring to age per page again. It's normal in between 90 and 110, so that's an acceptable blood pressure per Ralph. We don't need to give any fluids at this moment in time.
Just slip those two in
Yep,
for me,
certainly.
please.
Get these on. And if we run our ECG, does that come up as?
ECG is showing a sinus bradycardia.
Okay. So we could consider atropine if that persists. Carly, could we do a disability assessment, so everything neurological?
Yep, no problem at all. Hello, Ralph. Ralph, can you open your eyes for me?
Still no response.
I'm going to check his pupils.
Pupils are equal and reactive.
I'm going to do temperature again.
.36.5.
I'm going to do ABM.
.42.
That's complete, Sandy.
Thank you. Caroline, if you could do a top to toe examination for me.
Looking for any deformity, any signs of trauma, head, neck. Also, we've checked the front.